Hi, everybody. This is Dr. Gallus, and I have OR here today. And I'm on live for Carpools and Cannulas, episode, I don't know, like 11 or something, where I hope I'll be joined by Dr. Greer shortly. There she is. And we can talk about breast lifts. So I'm sure she'll be joining in a second. Dude, I gotta fix my hair. She should be coming on in 2 secs. This is like also known as, hey.
Hey, how are you?
I'm good. I'm stamping your style today. I'm like doing the bun.
The perma bun? Yeah. My hair's like down to, it's ridiculously heavy, so it's always up.
Takes it off. So How are you?
I am good. I just finished putting together a new bed for my son's room, so.
Oh, are we getting is it a change in like style or size or?
He had a full, we got a king because when my husband gets up with the baby, I usually sleep in one of the kids' rooms, and now I have like 2 kids in with me, and a full is not enough for 3 people. So his room is huge though. It's got a full and a king in there together. It's enormous. Wow. I've just given up. I'm like, whatever, we'll get a bigger bed.
I know. Just one giant mattress covering the floor, and then everybody can just pile on, right?
Yep. Dog too. Exactly.
Yes. I know. Somebody watched our dog while we were in Hawaii, and they're like, "Oh no," because they have a dog as well. They're like, "Our dog sleeps downstairs in the like basement on her bed."
Oh.
Like, oh.
Our dog has a footstool on the end of the bed, so he can get up more easily.
That's right. That's right. Accommodate. It's ADA compliant for the dog.
Yeah. I mean, it's a big height for a schnoodle.
That's hilarious. So, all right. Well, are you ready to chat about some breast lift?
I love breast lifts.
Okay.
I love them.
All right. I like doing them too. Today I did a breast reduction, which people often, there's some confusion. Sometimes they're thinking that when they come in for a breast reduction that I also won't lift the breast, which is...
Yeah, and it's like an intrinsic part of the surgery. You literally can't reduce them without lifting them in some way. Yeah.
So lifting the breast is really about recreating the shape. So what's your go-to technique?
It just depends because people don't necessarily understand, but you've got like lift on one end of the spectrum and reduction on the other, and it really just depends on how much tissue you take off. So if I'm really just doing lift and I don't want to take off any tissue, I will do the auto augmentation with that wedge of tissue from the lower pole. Like if somebody's had kids and they're kind of deflated or just doesn't want to be smaller. Otherwise, I'll just wedge out tissue all the way up to like a superior medial, rotating things in.
Okay. Yeah.
How about you?
Pretty similar. And so superior medial just means like when you're rearranging things or removing things, it's important to make sure the blood supply to the things that
nipple
around. Yeah. And so most important is the nipple areolar complex. So that's the areola. And there's a couple different techniques. The most common, I think, are superior medial pedicle. So leaving the nipple areolar complex, the blood supply on the top part of the breast, leaving it attached there.
Which is nice because it stays up where it's attached.
Old school was leaving it attached to the lower part of the breast, which is usually the part you're trying to ditch. But it was just how that surgery had evolved and it was long.
That's how I was trained. I came out of residency doing inferior pedicles, which is so funny because then you really learn about blood supply. And now when I do a superior medial pedicle, so the inferior pedicle, there's one tiny little vessel feeding that whole thing. It's just itty bitty. And the superior medial, they're coming in from the top and the side, superior and medial, in fact. And it's just, it's a nicer operation. I feel like the blood supply is more robust and the long-term results, I think, are a little bit better.
100%. And I agree. And I think now, maybe 20 years ago, if you asked a room of plastic surgeons what technique you would do, 80+% would say inferior pedicle. And now it'd be the reverse of that because of all the things you mentioned, the blood supply is better, unlike, we thought. And I always tell patients, listen, we're trying to preserve it on the tissue we want to preserve, which is your upper
Right.
medial portion of your breast. No one's like, oh, I'm too full here,
Yeah,
realistically,
I
right?
really
I
want it
don't
like
want
bottom down.
cleavage. Yeah, I want all my breasts on the outside, like in my armpit. That would be great. And
Right.
Aaron's probably
Yeah.
wincing from
Falling to
the
the side.
armpit. So
Well, and the other thing I love about it is I feel like I can make a smaller breast with a nice shape still.
yeah,
Because you can really reduce the tissue and do it evenly across the whole breast. It's nice.
yeah, absolutely. So yeah, so kind of same on the blood supply issues, and then it really just depends. So let's talk about. I guess I should back up and talk about breastosis or breast sagging, right? So it just
Yeah.
sort of
Yeah, because
depends on.
everybody wonders, have you heard of the pencil test? Because I hear that
Yeah,
one from a lot of patients. If you can hold a pencil up under it, a
then
lot
they're
of women can.
saggy.
Yeah,
Yeah,
and a lot of women can. That is not unusual.
right. I know. Yeah. So is that? Yeah. I don't think that's made it to the published literature, but it's a good way of
Yeah.
explaining kind of overhanging. But yeah, I
Right.
think some of it has to do with the pencil test, how much breast tissue is below that crease, which we call the inframammary fold. And
Mm-hmm.
then some of it has to do with nipple placement, like where is the nipple relative to all of that. So people
Right.
who have
Because
nipples high, low, pointing down at the ground, right? Those are all factored
yeah.
in.
And they're all normal variations. You don't have to be 40 and have had 3 kids like me to have a downward vector. I mean, I've had 25-year-olds come in telling me they had 90-year-old breasts. I'm like, no, they're normal. I know they're not what you want, but that's not unusual. So
Correct.
don't feel like there's something wrong with you.
Yeah, I've had young patients come in and say, it just also, so I recently had, okay, then my dog's joining. I recently had a young patient, like a teenager, come in for breast reduction, and and you can have lower nipples or nipples that are pointing down
Mm-hmm.
because depending on how fast you grew your breasts, like the skin just doesn't accommodate or it stretches out too fast, or even with
Yeah.
mood change. So yeah, it's not an age thing per se. It's there's multiple factors.
Yep.
So yeah, I do try to factor that in. And then you figure out how much is breast tissue below that crease, and then make your plan for rearranging it.
Right.
And right, the three most common incisions are just around the areola, the
Yep.
lollipop,
Which
and
has the
then
vertical.
yep,
Yep. And then the
and
underneath,
yeah,
which is the anchor style.
yeah. And I would say I don't do the circumareolar very often because
It like
oh,
flattens the breast a little bit.
yeah,
Yeah. It's fine if you just have your nipple is like a centimeter or two lower on one side, and that's really the only difference between the breasts. But otherwise, yeah, it just kind of flattens the front of the breast. You need that vertical incision to bring it back together and lift it.
correct. I feel like we share the same brain sometimes, but
We do operate a lot similarly. Like we have very similar practices, which is funny because we've only met on Instagram. We live on different sides of the country.
that's right. Yeah, so I agree. It only works if it's good, if it's 1 or 2 centimeters. I've seen some, what everybody calls botch now, but botch results where people do an augmentation and then they do the lift only with the circumareolar. But
Yeah.
again, it works if you're only going up a skosh. But if you're trying to scooch up 5 or 6 centimeters, that just ends up stretching out. So now you have a larger areola than you started with. And you're right, it flattens where you should be having projection. So
Yeah.
it gives a weird shape.
It
So
does.
all the things you're trying to do, which is avoid that incision, and just the trade-off is that the shape and the look are just not great.
Yes.
But
And with those incisions, I find one of the biggest concerns is what the scars are going to look like.
oh, totally, totally. So that's really why I think the push so some of these patients I've seen that had these circumareolar incisions, I mean, I think they just were, hey, we're going to do this without creating an incision, that lollipop incision.
Right. Because the areolar skin, it's this natural transition point between the pink and the white skin. So it hides better. But
mm-hmm.
yeah, the shape trade-off, I think is not worth it. And The other thing I always remind patients when they're looking at before and after pictures online, those after pictures are usually 3 or 6 months out. They're still pretty early because we're not dragging people in a year or two down the road to tell them they look awesome, as much as we love doing that. So
Right.
Often I don't have 1 year follow-up, and that's when the scars really fade nicely.
Yeah, totally. And I see patients that had previous full lifts, and I do a lot of either implant removal or revision augmentation, like exchange, and they had a lift at their original surgery. When they're 10 or 15 years out, I'll look at their photo real quick before I go in to see them, and I'll be like, I thought you said, do they have a lift? And I got to get up close and personal because the scar is so fine and white and you can't tell. So yeah, it's just nobody gets somebody back at 15 years to take those photos. So
right. But it does fade.
Yeah, for
Hello.
sure.
And then what is some minor bloody nose here? You okay?
I didn't know to put a popcorn thing in my mouth.
Wait, did you put popcorn up your nose?
I put a popcorn thing
in your nose. Yeah. Did you get it out?
Yeah.
Okay, that's good. Just okay, that's okay. Just hold a little pressure. Here, I'm glad you got it out. There's a trick for that, but okay. Okay, good. Minor emergency averted. Hey, can you go check on your baby sister? Thank you. It's fine.
Is that your son?
It was my daughter.
Oh.
She apparently put a popcorn kernel up her nose, but got it out, but it bled a little. You're good. Good job. You got it out. Strong work.
How old is she?
She is 5.
Oh, yeah.
Yeah.
Remind my now 13-year-old about the time we were doing our nails. We're just sitting around doing, nail day.
Yeah.
And she took the little capsule. We pour a little capsule of acetone in there to like
soak them.
Mm-hmm. Yeah. She just was like, knocked it back. We're like, what?
That's gonna taste tremendously bad. So poison control.
It ended up not being a big deal.
The seed was putting in, but I forgot it.
Okay, good. Okay, babe. Good job. Kids are amazing.
Yeah, so you're like, what's the motivation to drink the acetone? The nail polish.
I straight up remember cutting my shirt with scissors, like as a 4-year-old, because I just wondered, like, do these cut shirts like they cut paper? And I was just like, my mom's like, why did you do that? I couldn't articulate it. I did have a reason.
Just want to see what would happen.
I was very Yeah, I mean, I had a scientific mind even at the age of 4.
Yeah. And so does your daughter. What happens when I shove this popcorn kernel up here?
Minor bloody nose. Yeah, now you know not to do that. That's what you said. Good job. You're good.
They should really put a warning label on the popcorn. Also, don't put it in your nose.
Probably on there somewhere.
I took care of a kid. I did his cleft palate repair, and he was a little bit older when I did his palate. Like, he was maybe 7 months. So maybe 17 months, because we used to do it around a year. Anyways, a little bit older. Yeah, so he's about 17 months old. And I get in the OR, and there was a lot going on with the family, or whatever. So I'm not sure what the circumstances were, but it seemed very chaotic. So I go to do the palate repair, and you get in there. And so for everybody who doesn't know, cleft palate is like the hard palate where you stick your tongue up to the roof of your mouth. There's just a division. It doesn't meet in the middle. So when you're looking at it, you're looking up at the floor of the nose. So I go in to do the case, and I'm like, start picking, and I pick out like this corner of blue plastic that's basically like a Welch's fruit snack wrapper.
That's just like up in his nose.
Yeah, up there. And so then I I do the repair, make sure there wasn't anything else. And then afterwards, I was like telling the parents, I'm like, hey, I found like a fruit snack wrapper. And they're like, oh yeah, he sticks lots of things up there. I'm like, okay, well, he can't right now because I need that to heal. Did it all the time and they stopped checking? I don't know. I was like, okay, already then.
Okay, so, fun times.
Yeah, kind of random, but kids are random like that. So, okay. So where were we?
Restless. Minor distraction.
Also, here's our PSA, don't put popcorn kernels in your nose, right? I mean.
Yes. And also, if your kid sticks something up their nose and you cannot get it out, what you try to do is put your mouth over the other nostril and blow really hard with their mouth closed. And it can sometimes blow it out. Learned about that on Facebook. Yeah, haven't done that one myself. Learned from other doctors on Facebook. So
I hope not to have to. I think I'm out of that window, but you never know.
Probably, yeah.
I also still remember I was in ROTC in college, and one of the guys could snort his dog tag chain up and then
bring it out his mouth. Yeah. I've seen people do it like up the nose and out the mouth. No, yeah.
Yeah, that's not
people tricks.
Stupid human tricks, I think.
Yep.
Okay, so back to breast lift.
Right.
We're talking about incisions.
Yep.
So
scars.
So I'd say the most common is vertical. And then if you have tons of excess skin, then we're probably doing anchor.
Yeah.
If you already have an anchor incision, I'll often use that, but
just kind of neatens things up a little bit.
Yeah, absolutely. It provides ample shape. We didn't cover non-invasive breast lift because mostly I think it doesn't exist.
Is there a nose medicine?
I'm going to have to talk to you after, okay? I don't have any nose medicine. Sweetie, can you go ask Daddy for help? I'm on Instagram. She wants some nose medicine.
Oh. Aquafit.
Yeah. Wow, this is like the most distracting. It's cool though. Are there really non-invasive lifts? I mean, I guess you can do some liposuction, but you're not going to get that skin retraction, and that's usually the problem.
Right. So liposuction, I've seen people lecture on that. It's really hard to do. It's also a gamble because you don't know how much is breast tissue, how much is fat. So
right, and that breast tissue is fibrous. You cannot liposuction that out.
Not going to get lipoed. I've seen Dr. Roger Corey has tried to do, I saw him demo it. It did not catch on. It's probably 10 years ago.
He's the Brava guy, right? Okay.
I mean, he's an outside-the-box thinker. God bless him. I don't know who he gets to do this, but patient-wise, was using basically a super long suture on a ginormous needle and, like, sticking it in subcutaneously to, like, tighten up. And I was like, okay. No, doesn't work. And then the last is I know people have been using non-invasive, so they've done it with Thermi. There's Dr. Diane Duncan in Colorado will do it with Renuvion, and somebody else will also do it. I feel like they might do it with Body Type.
Those get nice dermal tightening, but again, the issue is really the shape of the gland.
Yeah,
and
it's that a tiny little bit of lift. I mean, minimal.
Yeah.
So, yeah.
I'm a big fan of
That's what I'm saying. Everyone is looking for the incisionless. Oh, and thread lifts. Have you seen that done? Well,
in the breast, no. I mean, actually, someone just asked me today what I thought of them in the face, and I'm like, they're not super reliable. They're hard to get out if they're asymmetric.
Yeah, they've tried them everywhere, above the knees, for the booty. So, yeah, when you're fighting gravity like that, there really is no non-invasive treatment, but people are always looking for one because it would be nice to do a scarless breast lift, but it just hasn't happened yet.
Yeah, it's like that scarless mole removal everybody's hoping for. It's just not working.
Yeah.
Yeah, but the thing is, like, the scars fade well, and the shape is what's going to be more noticeable. So
over time for sure.
But I mean, I'm obviously biased because I do a ton of breast lifts.
And then would you say, so the two most common things that are combined with a breast lift are either fat transfer or augmentation, right?
I honestly, I do not do a ton of fat transfer to the breasts, occasionally for asymmetry, but usually people want a little bit more size increase. So usually aug for me.
Okay.
Yeah.
Augmentation. I would say that's the number one, a lift with an augmentation. I'd also say a close number two for me is removal with a lift.
Of implants, right.
Yeah. Because if you had implants in for any, they've stretched out the tissue, so taking them out, it would be nice if everything bounced back, but it usually doesn't. You're usually older than when you started, maybe you had kids, all of those things. So I think I commonly do that as well, take them out and then do a
just
lift.
To tighten that skin envelope back up and reshape it.
Right. And then I do a fair amount of fat transfer as long as people want a little bit of upper pole fullness or a little modest increase in volume. You get the benefit of getting liposuction, right? So you're like, the stubborn abdominal fat, or I really hate, my love handles or my thighs or whatever it is, take that fat. And then as long as you're not trying to go much larger than half a cup size or cup size more, and you're not looking for that kind of over projecting upper pole, then I think it's a good option.
Yeah, but it is a subtle improvement. The other thing I like to do for that upper pole is I've been using a lot of Galliflex lately, just to act as an internal bra.
So do you change your pedicle? I'm going to bore everybody for a minute. Or you still use a superior medial pedicle?
I still use superior medial, and then I elevate the skin flaps just at the level of the breast capsule. So they're thin and thinner women. And then just suspend it like a sling, so it's tacked to the good periosteal fascia. It gives nice fullness.
And then lay everything over it.
Yeah, and then just lay the skin back down. And it really, so I do everything the same, and then I elevate those skin flaps once I brought the lateral and the medial pillar back together. And I've done it with reductions
so it's reinforcing that. So
it's like holding the whole breast. It's between the skin and the breast tissue.
Okay.
And it kind of makes it look like a younger breast, because that upper pole fullness gets kind of flattened and deflated as we age, and it really fills that back out.
Nice. And so you're just leaving the medial and lateral pillars are just attached to the chest wall, right? That lower
correct
is not
connected
to the superior medial pedicle, right?
Right.
Okay. Cool.
Yeah.
They just got bought out.
I heard that today.
Or purchased, right? I talked to a rep, and she's like, 90 days, I'll be your rep, and then we'll see. I'm like, that's what I heard.
Yeah, I have to email my rep. But I just put in an order today, so at least they'll get that for me.
Yeah, I guess they're on board for 90 more days, and then they're all going to somewhere, I was going to say somewhere boring, but I know that it'll okay.
You mean like Cleveland, Ohio?
No, it was like New Hampshire or something. I'm like, doesn't sound. It's not Vegas. They're not going to Vegas, but they're all going for a meeting to be like, okay, this is
reorganize.
Restructure, and then they have 90 days to figure it out. And then BD bought them, which I think is who? Becton and Dixon? I'm not sure who BD is.
I don't know them. Yeah. I mean, I like the product a lot. A lot of people ask if it's like the mesh used for TBTs and hernia repairs, and it's not. So it's not the mesh that's going to stick around or cause problems. It totally dissolves fairly fast. It just makes you lay down more collagens. And I actually did take it out in a patient once because she'd had an AUG and then she had a revision, and they only put Galliflex on the left. And I was removing the implants and doing a lift, and I don't want to leave that in there for symmetry. And it's very easy to take out. It's just like this.
There, it doesn't completely incorporate.
The Galliflex was totally gone. There was just this perfectly rectangular, thickened area of collagen. It was amazing. Yeah.
Oh, cool. Yeah. Would you say you use the Galliflex on every lift, 50% of your lifts?
I like to offer it up whenever anybody's really kind of hollowed out over the upper pole. I mean, it's not, it's $1,400 just in product cost. So not everyone wants to do it, but especially in my patients who maybe have a little less skin elasticity and less upper pole fullness, I do bring it up as an option to show them, this is going to make the breast look younger as opposed to just being higher up.
Cool. Very nice.
I like it. I mean, I think when I get my lift down the road, I'll come in with a couple pieces of Galliflex. My surgeon will be like, for the love of God, don't bring your own implants too.
Put this in. I sort of remember back when, did you do general surgery first?
No, I did. Okay, I just did it combined. Yeah.
Integrated. So for a while, Sepper film was a thing. Remember that stuff?
I remember that, to prevent abdominal adhesions, and it was just like a gelatinous mess.
It was a mess. But for my first C-section, they're like, we're gonna lay a little of this in, before we close. I'm like, okay, thanks. But
that's awesome.
Bring your own Sepper film and hope you don't need to come back for a bowel.
I think that seems reasonable. I pity the poor one of my friends whom I pick as a surgeon. You're in the running, so try to avoid me. Because I'm going to bring my own 3D renderings from Chrysalis. I'll be like, this is what I want. I brought you some Galliflex.
I have some Instagram photos of what I'd like to have it look like. Yeah,
totally. Also, let me tell you what pedicle I would like and how I would like you to close, which sutures you should use.
Which sutures I would prefer. That's hilarious.
Yeah.
That's all right. Yeah, cool. So, okay, so Gallifex is an interesting, like, I think, option for lift. Do you use it in breast augmentation revision, or do you
I
use it anywhere?
do. Although there I'm not, so it kind of depends. I used it in a revision a couple weeks ago where I was moving from a subglandular to a submuscular because she had cap con. And it's nice just to close off that lateral pocket and make sure the implant stays under the muscle.
Right, right. Okay.
And I'm using it in a tummy tuck coming up too, just because they have a really thin abdominal wall and I would like a little more robust healing.
Nice.
Yeah.
Okay. Yeah, you are using quite a bit.
Yeah.
Cool. Yeah, and then I saw that there's Gala Light out right now, but I haven't.
Yeah, I haven't learned. I was literally on the website looking at sizes and saw that and wondered what it is. I'll have to ask my rep before his 90 days.
Before they leave, and then you have to like start all over again.
Yeah.
Bummer. So, well, it's probably a good time to see if anybody has any suggestions for what we can talk about next time. By all means, like put that in the comments. We'd love to.
Or if you have requests of fun tricks our kids can do, like drinking acetone or putting popcorn kernels up their nose while we're on Instagram. Because that's...
Yeah, we can see if we can have that arranged.
I know. I was telling a patient today, she said, I saw you on TikTok. I'm like, you could play a drinking game out of my TikTok if you just take a swig every time one of my kids appears behind me and throws a piece.
And tries to interrupt. That's
yeah, they just pop up. They photobomb all the time. It's fantastic.
Yeah, so just let us know, DM us, or I think you're up next for hosting.
Yes.
And then we'll figure out a topic. I'm sure there's things we could discuss. I'm trying to think. Breast lift we've done. We've done breast aug. We could talk about recovery after something because we haven't.
Yeah. I mean, we could talk about tummy tuck recovery. That's always a big question.
Yeah.
I feel like people think it's going to be a lot worse than it is. Or that they're going to be like not working out for 2 months. And...
Oh, right.
Yeah.
Yeah, it's always hard to know where people are coming from because their expectations are either. I have patients who like text me a couple weeks later and are like, "No, I can Peloton." I'm like, "No."
No, I had one lady, bless her heart, delivering Avon the next day. I'm like, go home and sleep.
Yeah, right? Yeah, how many people like take it easy is important. But then there's other patients who are like, "Oh, I won't be able to do anything for 3 months." And you're like, "No, you'll be okay.
You can actually go back to work." Yep.
Yes, yeah.
It's okay.
Absolutely. All right.
Awesome.
Well, maybe we'll talk about recovery, and we can start with tummy tuck recovery. Maybe we can cover a couple of different common recovery questions.
Absolutely.
That's reasonable.
Cool.
All right. Well, I think we can wrap it up, and you can go make sure the nose is okay. I put aqua on everything.
I know. That'll probably be my nose medicine.
Nose medicine.
Well, Vaseline. It's fine. I'm just proud that she was bleeding and came to me very calmly. She's like, I'm bleeding. Shove this up my nose.
Bleeding.
It's fine. Very calm.
Oh, goodness. All right. Well, have a good night.
You too. I'll see you in a couple weeks.
Okay. All right. Bye.
Bye.